Hello, good evening, everyone. Good evening. You're welcome to Ask the Pediatricians Live. And today is a special occasion because yesterday was World Malaria Day. So today we will be taking your questions on malaria. Our doctor, Dr. Tochi Alex Okoro, will be speaking to us on malaria first. Then after our short presentation on malaria, we will now have the time to ask questions. So while you're trying to invite your friends, join us, I will just quickly share the video on our groups. So if you are live, drop a comment. Let's know you are live. Tell us something. Let's know. Tell us something. Let's know you're live. I can't. Okay, yeah, we have 4 people. Oh, good evening, Augustina Ortega. Good evening. You're welcome to Ask the Pediatricians Live. It's World Malaria Day. Yes, it was World Malaria Day yesterday. So we will be. Sorry about that. Yeah, so we will be taking questions today on malaria. And before then, we have quite a number of people live right now. So before then, Dr. Tochi would be taking a session on malaria. She will tell us what she has to say about malaria, and then you can now ask your question. I'll let you know when it's time for questions, but let's say hello to those who are joining us. Augustina, thank you for joining. Amira, Chris, Abubakar, Rosemary, good evening. Okay, so while we say good evening, please let's share, invite your friends, share to groups that allow, and please, I'm doing that now, so give me a second to share and host a watch party. So Dr. Tochi, good evening. How are you today, ma'am?
I'm good. Good evening. Good evening, Dr. Vera. Good evening, everybody.
So good to have you on board. Dr. Tochi, before we continue, I'll just quickly want to host a watch party on both our groups so that we have more audience. And yes. So how was your day, Dr. Tochi?
Good. So far, so good.
Not how was your day? Your day is still very much on. Your day is still very much on. So how is your day going? That's the appropriate question to ask you.
So far, so good. How was yours?
Oh, well, it's been a very busy one, but we thank God it's almost over. Okay, so, okay, Dr. Tochi, please tell us, what do you have for us today? Share with us, please.
Okay, good evening, everyone. Thank you all for joining us for another Ask the Pediatrician Live. Like Dr. Vera said, it's a special one today. April 25 every year is World Malaria Day, and that was yesterday this year. So we decided to discuss malaria today. Okay, so malaria is a very common illness. Like almost everybody knows malaria, especially in Nigeria, because Nigeria is one of the countries where malaria is endemic. And I would also say that it's kind of maybe underestimated, the gravity of the disease and what the disease can do is kind of sometimes underestimated. So I thank God for this opportunity, for us to educate ourselves and create awareness of this deadly disease called malaria, what we can do to prevent it and reduce transmission of malaria. So like I said, malaria is a very common childhood disease. In fact, it's the most common childhood killer disease. It's one of the most common childhood killer disease in Nigeria. It's the third most common deadly childhood diseases in the world. The first two are diarrhea and pneumonia. So after diarrhea and pneumonia, we have malaria as one of the as the third deadly childhood diseases. So it's something that we should really be aware of. It's something that we should know what to do when we have it or when our child has it, and something we should know how to prevent, because malaria is a very preventable and treatable disease, yet it kills a lot of people every year. In 2019, according to the World Health Organization, an estimated 229 million cases of malaria were recorded worldwide. 409,000 deaths from malaria was recorded. You would agree with me that this is quite a large number. It's a
Yes,
huge
it
number.
is.
Yeah, it's a very huge number. And to think that this is a treatable and preventable disease, yet it keeps ravaging. Of these numbers I called, 94% of these cases and deaths were in Africa. So Africa is still like the hub kind of malaria, the continent that harbors most cases of malaria. And then at least 53.7 million Nigerians were infected by malaria in 2019, and we had 81,640 deaths. And I believe that there may even be more, but this is what we have on record. You know, in Africa, in West Africa, Nigeria accounts for 53% of cases of malaria. So you can see that we still have a long way to go.
We
And
do.
of these, children under 5 account for two-thirds of all malaria deaths worldwide. So the deaths from malaria happens more in children 0 to 5 years. So it's our responsibility to take care of these vulnerable ones. WHO is aiming to achieve zero cases of malaria in most countries, especially in Africa. Some other countries have, gotten to this milestone. There are some countries. Algeria in 2019 was declared malaria free. Morocco in 2010 was declared malaria free. These are just some of the African countries. Nigeria, we are still on our way. We are not yet there. So malaria is okay. A little bit more on epidemiology. Nearly 750 children die daily of malaria. When you put it in another way, it means that every 2 minutes a child under 5 dies of malaria. Like I said before,
Wow.
most of these deaths occur in sub-Saharan Africa, of which Nigeria is one of the countries. So we really need to be aware of this disease. We really need to know what to do to treat and to prevent the disease. So malaria is caused by a parasite. It's called Plasmodium. That is the parasite, and it has five species of this parasite that causes the ailment, and two of these species are of greatest threat. Two of these species are of greatest threat. So these two species are Plasmodium falciparum and Plasmodium vivax. So this is just, let's just know that malaria is caused by a parasite called Plasmodium, and there are 5 species of the parasites that cause malaria in humans, and two of these species, Plasmodium falciparum and Plasmodium vivax, pose the greatest threat. The species we have commonly infecting us in Nigeria is P. falciparum. Okay, so how does one get malaria? This malaria is transmitted to humans through the bite of a mosquito. So the mosquito is like the vector that harbors the parasite. Okay, so what happens is that when an infected female Anopheles mosquito bites a human, it introduces a parasite into the bloodstream of the host. The host now is the victim, the human that was bitten by the mosquito. And then this parasite goes ahead to travel in the bloodstream of the human and undergoes a lot of changes in its life cycles, or some occurring in the red blood cells and some occurring in the liver. And finally, now takes root in the liver of the host, and from there it's now released periodically into the bloodstream, where it now causes different symptoms that manifest in the person. Okay, so now what are some of the symptoms of malaria? Some of the symptoms Okay, first of all, malaria manifests about 8 to 25 days after an infection. So you could get bitten by an infected female Anopheles mosquito, and you may not manifest symptoms until 8 days later, or 2 weeks later, or between 8 to 25 days. So that's like the incubation period of the parasite. Okay, so common symptoms of malaria include fever, cough, joint pain, malaise. Malaise is just a general feeling of unwell, like you just don't feel yourself. For older children, they could complain of headaches. They could also have nausea and vomiting. They could have abdominal pain. They could have fatigue, muscle pain. These symptoms initially may be mild, but if left untreated, they could go on to cause severe illnesses and sometimes death. So it's very important that when we notice any of these symptoms, we take our child to the hospital where a doctor will see your child, examine your child, ask you some questions, and perform a test to confirm that your child has malaria, after which appropriate treatment for the appropriate duration is given. We should also note that some of these symptoms are not really specific for malaria. For example, fever. Fever is a very common symptom of malaria, but it is not synonymous with malaria. The fact that you have fever, the fact that your child has fever, does not mean your child has malaria. There are more than 1,000 causes of fever, you know.
Yeah.
So we need to confirm. Same thing with some of the symptoms I mentioned: cough, abdominal pain, and all that. So when your child has any of these symptoms, what is expected of you as a mother, or as a father, or as a caregiver is to take the child to the hospital and let the child be seen by a doctor and get tested. Then as soon as malaria is confirmed, appropriate treatment will be given. We still have to talk about some of the complications of malaria. So most times when a child dies of malaria, it's as a result of some of these complications. Like I said earlier, the symptoms initially may be mild, but if left untreated, it can progress to cause life-threatening complications and sometimes death. So some of these complications are cerebral malaria. This is when the malaria parasite travels to the brain and causes damage. It could cause seizure. Your child will start fitting, start having convulsion. It could cause coma, and it could also cause death. You could have breathing problems. Malaria can cause fluid to accumulate in the lungs. Where you should have air, you will have fluid like water, kind of, and it's called pulmonary edema, and it could cause breathing problems in your child. It can cause organ failure. Malaria can damage the kidneys, the liver, can cause organ failure. It can cause the spleen to rupture. It can cause severe anemia. Part of the life cycle of the parasite occurs in the red blood cells. So this can damage the red blood cells. This can deplete their number and cause anemia. Malaria can cause hypoglycemia, low blood sugar, and when your blood sugar is very low, or when a child's blood sugar is very low, it will cause coma or death. So like I said earlier, and like I'll keep saying, it's very important that malaria is identified on time. When it's treated early enough, these complications are avoided. The child doesn't need to progress to get to be that bad, to experience any of these, before treatment is instituted. And then I also want to emphasize something that I've said like twice or so. One of it is that malaria, like I've said before, is transmitted by the bite of an infected female Anopheles mosquito. So why I'm emphasizing on this is that the fact that your child was bitten by a mosquito does not mean the child has malaria, So we have several types of mosquitoes. We have some mosquitoes that are not Anopheles mosquitoes. So if your child gets bitten by any mosquito, probably not an Anopheles mosquito, it's not likely he will have malaria. If your child gets bitten by a male Anopheles mosquito, it's not likely your child will have malaria. If your child gets bitten by a female Anopheles mosquito that is not infected with the parasite, it's not likely the child has malaria. So I'm taking it bit by bit like this so that you can understand that you need an infected female Anopheles mosquito to transmit the parasite. You know, most of us, some mothers, once they see a mosquito bite, like the mark on your baby's skin,
Absolutely.
anti-malaria,
It's
you
great.
know, and say yes.
Thank you for
or,
this clarification. Very
or
key.
maybe they heard buzzing, a lot of buzzing last night. They'll be like, mosquito is too much in this house, so anti-malaria. And this indiscriminate use of anti-malaria medication has led to a lot of drug resistance, you know, and this slows down our fight to achieve zero malaria cases. When we have drug resistance, and then when your child needs to take the drug and then the drug will not achieve the expected result. So please, let's stop giving anti-malaria indiscriminately. There is a very beautiful video on the ATP Facebook group. If we can all go, I don't know if maybe some people have not watched it, if we can go there to access that video, it's very self-explanatory, it's very, very beautiful. You know, it gives us, it's very educative. If we can all go there to listen to that, that will do us a lot of good.
Right. So that what Dr. Tochi just told us about is on the announcement of the Ask the Pediatricians Facebook group, and it's on our YouTube channel too. Just go and watch or go and listen, watch that video. It is interesting, all right, and it is educative.
Yes.
Thank you, Dr.
Okay.
Tochi, for bringing that up.
Thank you too. Okay, so let's talk about some preventive measures to for malaria. So the best way, like I said earlier, to fight malaria is to prevent it in the first place. So if you can prevent infection, you know, if you can prevent the infection in the first place, you know, then we are more than halfway on our way to eradicate the disease. So one of the proven ways, and which is also WHO recommended, is sleeping under insecticide-treated nets. It's been proven that it's very effective in halting the transmission of the parasites. It's been proven that this parasite, the mosquito bites are usually from dawn to dusk, you know, the period when we are asleep. So it's very important that we keep our children under insecticide-treated nets. Another proven way is the use of sprays, insecticide sprays, indoor sprays. It's another proven way to halt the transmission of malaria. You know, spraying our houses periodically so that if there is any mosquito within, you know, it can take care of it. Other measures also include eliminating the breeding sites of the parasite. So malaria, the mosquito usually breeds in stagnant water. So if we could eliminate stagnant water, maybe you have tins, maybe it rained and then you have puddles of water or empty tins or empty cans around your neighborhood, you know, and then the water is just sitting there, or you have gutter that doesn't flow. So you could just eliminate all these. All these are potential breeding sites of the parasite. So eliminating these breeding sites will also go a long way in preventing the disease. You could also clear bushes around your house. These are things we could do on our own, you know, not necessarily the government will do for us or something. These are measures these are things we could do on our own. Excuse me. So we could clear bushes, eliminate stagnant water around our houses. Okay. So treatment of malaria, there are established treatments of malaria. Where we are now is the artemisinin combination therapy. So but like I said earlier, we shouldn't abuse. Most of these drugs are over the counter in Nigeria, but we're not encouraged to abuse malaria drugs. We're not encouraged to take them if the disease has not yet been confirmed by a doctor. So we are encouraged to take our children to the hospital when they are sick and let them be examined, let them be tested in the hospital. And then when it's confirmed, appropriate treatment will be instituted. Okay, so in conclusion, like I said, like I've been saying, malaria is a highly preventable and treatable infection, but unfortunately, it's still a major childhood killer disease in Nigeria and in Africa. We've already talked about the preventive measures. We've talked about things we could do to prevent transmission. Like I said earlier, early diagnosis and treatment is important to prevent any of those complications I had mentioned earlier from developing. I think I'll just be stopping here and taking any questions that we may
Question.
have. Yes, so thank you once
Okay, all
again for
right.
the audience.
Thank you so much, Dr. Tochi. And I mean, one take home for every one of us. This is something we always find us here on Ask the Pediatricians. I just saw a mosquito bite on my child's body. I want to treat malaria. Should I be treating every month? And all of those
Yes,
many
no,
questions. You've
not
answered quite
necessary
a
at
number
all.
of questions. Yes, that people will ask. So, viewers, please ask your questions. Ask your questions. Dr. Tochi has given us a very insightful, very succinct presentation on malaria. I mean, we are all on the fight against malaria. And so she has done justice to that. So begin to ask your questions. If you have any question, please ask. I have seen one question. Let me take that now. Olauton is asking, Doctor, when is the right time to treat malaria in children, even when they don't show any symptoms? My son is 15 years old.
15 months. Okay. So Olaito, thank you
Sorry,
for your
15 months.
question. The thing is that there is no right, the right time, okay, let me put it this way. The right time to treat malaria is as soon as malaria is confirmed. If your child doesn't have any diagnosis, like your child doesn't show any symptoms, like you just said, then you don't need to treat malaria. Okay, so malaria is not something you treat routinely, like every month, every 3 months, even every year. You could stay for 1 year, 2 years, 3 years, start taking anti-malaria because you've not been infected by malaria. So like I've been saying and like we are saying, there is no the right time. The only right time to treat is when it's been confirmed by a doctor that your child has malaria. Your child is 15 months, your child doesn't have symptoms, perfect. Keep giving him healthy foods and doing what you're doing, and you don't need to worry about giving him anti-malaria.
Okay, so that's for you. Although you've heard from the doctor's mouth, she has said exactly what you should do. All right, so do we have any other question? You should have questions. So please ask your questions. Specifically today is for malaria, but if Dr. Tochi has time, we can take any other child health question or even adult question as relates to the topic for today. However, if we do not have such questions, we could take some questions, I believe. So, but let's concentrate for now on questions on malaria. So tell us, ask Dr. Tochi your questions on malaria. Okay, Dr. Tochi, do you know there's this thing with this medical practice? We hear some doctors teach people or ask people to take malaria medication every other month or every month, especially when you know that you live in a mosquito infested area. So how does that work? Why would some people tell us do this, and then of course what we say here is we shouldn't do it? What is the rationale behind that thought?
Okay, so well, I may not really know exactly why they say that, but this is like say like evidence based. Generally it's not advice. There are some groups, vulnerable groups, that we give preventive measures for malaria, and this example is for pregnant women. Like we give pregnant women within the course of their pregnancy anti-malaria to prevent infection. We want to catch it even before it comes because of the effect on the unborn child. But taking it routinely for an adult in an endemic area or just that, we do not advise that. So we don't advise you just take it every month or every 2 months, whether an adult or a child.
Thank you so much, Doctor. Okay, so someone is asking a question. Awosonya Oluwase. Thank you, Ma, for the lecture. Please, is it okay to use Odomos on babies?
I want to believe Odomos is like, I think it's
Insect
an repellent, right?
Yes,
Okay,
yes, it
okay.
is.
Well, as long as in the what they call it, like manufacturer's pack or something, it's not contraindicated, and then you avoid open wounds, and the eyes, like the face generally. That's you just I children, they also put their hands to their faces. I think you could,
Right,
as long as you just
right.
avoid it from getting into their eyes, if you are able to. If not, you could just do insecticide treated net and sprays. When they are old enough, then you can do odomos.
Okay. It looks like this question about Odomos is very serious. So the next person is still asking something in line. Um,
Okay.
is it okay to use repellent for toddlers even at night? Okay, so
Okay, so this is the same answer. This is a toddler now, and just avoid it on the face. That's my emphasis. Avoid it on the face.
okay, okay. All right. So what about Dr. Tochi? What about for adults?
The odomos,
Yes.
yes, it's okay. Adults can
Okay.
use it, yes,
Okay.
and
Okay.
even
So
older children, yes.
okay. So viewers, you've heard that right from the doctor's mouth. You can use it as an adult, but children, it's a no-no. She has said that because sometimes the children might put their hands in their mouth and then you're
Their
just
face too, yes, and
poisoning
you're
them
not
and all
there
that.
with
So that's
them, yes.
yes, yes. Okay. Hello, Dr. Bemi. Good evening. Dr. Bemi saying hello to you, Dr. Tochi.
Good evening, ma.
All right, thank you, ma'am. Dr. Tochi, I just had to go check the post where we advertise
Okay.
this, and I can see one question. Someone
Okay.
is asking Sule Martha. She's saying, "What are the signs and symptoms of malaria in children?"
Okay, so I don't know if the person has been listening in, but let me just still repeat them. Some of the signs and symptoms of malaria in children include fever. If in older children, they could complain of headaches. You could have shivering. You could have vomiting, abdominal pain, malaise. What we call malaise, general feeling of unwell, joint pain and all that. So, like I said earlier, these symptoms are not specific to malaria. There are also other diseases that could present with some of these symptoms. So, the fact that your child has fever, for example, doesn't mean your child has malaria. The fact that you felt your child's temperature with the body, with your palm, or you measure with a thermometer and it's high, it doesn't mean your child has malaria. So when you notice any of these symptoms, the right thing to do is to take your child to the hospital. The child will be seen by a doctor, examined, investigated, and then when malaria is confirmed, then the treatment will be instituted.
Fantastic, fantastic. Thank you. So Dr. Tochi has done a recap on that. She has told you the person who asked that question, the symptoms of malaria. And then when you find those symptoms, she's reiterating that you shouldn't treat yourself. What you need to do is to go see a doctor. Okay, Dr. Tochi,
Okay, go ahead.
okay, please go ahead. Please go ahead.
Okay, so I just remembered something I wanted to mention. Just by way of informing us, there is no person-to-person transmission of malaria. Like you can't get malaria by being in the same place with an infected person or sharing things, no matter how close it is to an infected person. So, like I said earlier, you need the bite, you need that vector, the mosquito, the infected female Anopheles mosquito. That the vector is what introduces the parasite into humans. There is no person-to-person transmission. I just wanted to point it out because I missed it earlier. Thank you.
Yes, fantastic. Thank you. Thank you for that addition. Okay, good evening, La Viva. Good evening. She's saying
Good
good evening to
evening.
us,
Good
Doctor. Good
evening.
evening. And okay, so I was saying thank you for your response. So I'm sure
Thank
she
you.
got value. Okay,
Okay.
so Dr. Tochi, while we wait for others, ladies and gentlemen, please send in your questions. Dr. Tochi is still here to answer your questions on malaria. And like I said, she's happy to answer maybe one or two other questions that you have. Okay, so Dr. Tochi, before the next person drops his or her question, I wanted to ask you about cerebral malaria. Do you want to tell us a bit about that?
Okay, so like I mentioned earlier, when I was talking about the complications, it's one of the complications of malaria. It's life threatening. So this happens when the parasite travels to the brain. and causes damage. It's life-threatening. Like I said earlier too, it could present as seizures. It causes the child to fit, having convulsions. The child could go into coma, and it could cause death. So, just like we are saying, to avoid the cerebral malaria, which is a complication, or any of the other complications of malaria, early treatment, early diagnosis and treatment is key. When we diagnose it earlier and treat, we could prevent cerebral malaria or any other of the complications.
Right. Thank you so much. Dr. Toki is still here. Please ask your questions. Enjoy the next 30 minutes asking Dr. Tochi whatever questions you have about malaria or about any other child health, any other health issues. Okay, it could be child health as well, and it could be your own health issues too. Dr. Tochi will be available to respond to that. Okay, so Dr. Tochi, there's this question that usually comes up. People wonder that when they buy the mosquito net, are they supposed to air it for 48 hours, or is it 24 hours? Or are they just supposed to use it like that? Are they supposed to wash it? So there are different questions around the use of insecticide, mosquito. What do you call that now?
Mosquito treated, insecticide treated net.
Yes. Yeah.
Okay, so when you buy it, you're not supposed to wash it. Some people have maybe because of the smell or something. Some people may maybe have like some reaction, maybe like sneezing and all that. But I'll say if such reaction is much, you could just air it, but definitely should not wash it before using. But if it's okay, like if you bring it out, and I think that happens more when it's been stored for long. You know what happens when you store something for long and you're just bringing it out and it's all dusty and you're sneezing and all that. But apart from that, once it's treated, and so once when you get it, it's ready for use.
Okay, all right, thank you. So another question that usually comes up, Dr. Tochi. Okay, I'll hold on that question because I have seen the question now. Okay. This question is from Olanike Ogundipe. Good evening, doctor. Please, what can I use for my baby rash? Doctor, taking you to baby rash.
No problem.
Baby rash on the skin. Okay, not on the bum. On the bum, we have used Triple-10. What else can I use? Okay, so she's asking that what can she use for baby rash on the skin, not nappy rash, precisely. Yeah.
Okay. So the thing with rashes, both for children and adults, is that it's better to be seen. There are several things that can cause that rash you're describing or you've mentioned now. So the fact that it's just baby rash, there are a lot of things that could cause baby rash. There are several ways baby rash could present, and we are not seeing it. I'm not seeing it. So I would advise you take your baby to the hospital. Since you've tried Triple-10, please do not give any other thing. Like, don't keep trying different things. Don't do trial and error. Just take I saw your baby is 3 months plus, okay? So just take your baby to the hospital and let the baby's skin be examined by a doctor. Then afterwards, the doctor will know exactly what the child needs. And also ensure that you're dressing baby up according to the weather. Don't overcover the baby. When the weather is hot, if you are hot in the room, if the room is hot, dress lightly. When it's cold, you cover up. So just do this and then take your child to the hospital to be seen by a doctor.
Right. Okay. So I will say I ask another question for you, Dr. Tochi. So how long should mosquito nets be used before changing? Okay, that's an offshoot from my question.
Okay. I'm actually not very sure of like a specified time, but if it's written in the pack, I think there is no harm in checking. In the pack it came in. Yeah, there is no harm in checking, but I think maybe I need to confirm that and maybe post it in the group or something.
Right. Okay, so I think your question, you've answered that question really, because it might be dependent on what she bought. I mean, what type. I mean, what it covers. So you might want to just check with the manufacturer. Yes, I think so. Okay, so please go and ask your questions. We're still live. We're still here. and we're ready to take on your questions as much as we're able in the next maybe 26 minutes. So, Dr. Sochi, the question I was going to ask is about breast milk. Yes, we keep hearing moms asking that I have malaria. I want to stop breastfeeding my child because I'm afraid that I'm going to transfer malaria via breast milk.
Okay, so that is not a known method of transmission of malaria. You know, like I said, we don't really have person-to-person transmission. So if you're sick, if you have malaria, go ahead and treat yourself and continue breastfeeding your child. It's not a known method of transmission of the parasite.
Right, fantastic. Okay. Okay, she said thank you. So go on, ask your questions. Okay, Dr. I have another question I'm just seeing here.
Okay.
My question is, having been treated with anti-malaria, also took injection, and one is still feeling feverish and weak. What is the solution to this?
Okay, so now two things. I'll start with the first. I mentioned earlier that fever is not fever and weakness is not like it's not only malaria that could cause fever and weakness,
yes,
you know.
yes.
So if you've been appropriately adequately treated for malaria and then the symptom is still of fever and weakness is still persisting, then the diagnosis should be reviewed. You know, it should be confirmed. Further testing should be done to be sure that there are no other causes. There are other causes, like several other causes of fever and weakness. They are non-specific symptoms, so it should be confirmed. Other causes should be ruled out. Secondly, is that it may also be. We can also not rule out a case of resistant malaria. There is a lot of resistance, especially because of the abuse we have in Nigeria, or the abuse of anti-malaria. So it can also be resistant. So I would advise that you go back to the hospital where you're receiving treatment and let you be reviewed by the doctor. The doctor himself will be able to rule out several other causes and know whether he's dealing with resistant malaria or sepsis or some other thing that could cause fever and weakness.
Right. Okay. Thank you so much, Dr. Sochi. Okay. Someone is asking here, is there any affordable home test kit for malaria home tests?
Home test kits. I'm not aware of anyone in Nigeria. Yes. I know there is what we call RDT, Rapid Diagnostic Testing Kit, but I'm not sure what you mean by affordable, and I can't really give a quote of how much it is, but there is such like rapid diagnostic kit or something. I'm not sure how much it is. That's the one I'm aware of. Yes.
Okay. All right. So, Dr. Sochi, someone happy is asking a question. This is not malaria, but let's take it since it's coming in time. Happy Okonkwo is saying, good evening, doctor. Please, when is the right time to give baby first dose of rotavirus vaccine?
Okay, so I don't know how old your child is now, but from 6 weeks, 10 weeks, 14 weeks, you could give rotavirus. I think even before 14 weeks, you should give the first dose of rotavirus. So if your child is not yet up to 6 weeks, then 6 weeks is a good time to do that.
Yes. Okay. So I'm happy you got that. If your baby, tell us your baby's age. Okay. Like we always advocate, whenever you're asking questions about your child, always tell us your baby's age and tell us if it's months or years. So Happiness, you want to give us that question again, or you just want to tell us your baby's age? Dr. Sochi has answered you already anyways. The first dose should be taken at 6 weeks. Okay. So tell us how old your baby is, and then she will give you further advice. That's for Happiness Okonkwo. All right. So do we have more questions? Okay. Oh, our baby is already 4 months old.
4 months. That's like 16 weeks. No, 16 I don't think your child can take it. I think he has passed the age. Mm-hmm. Yeah, that's 16 weeks.
So, All right, so happy that's for you. But as much as possible, you want to just help your child prevent, do more prevention so that your child does not come down with the virus. All right, so for Lauren Shaw Basirat Ajayi, good evening, doctor. My baby's weight, my baby's my baby weight at birth was 3 kg, 6 weeks immunization 4.5, 10 weeks immunization 4.3. She's on EBF. Should I be worried for the reduction in weight? Thank you.
Okay, so she lost 2 kg, 0.2 kg in 4 weeks. Actually, well, it should be investigated. You should be worried. Like, you should wonder why. Your baby should have gained more, and then your baby is losing. So we want to be sure that you're giving your child the breast milk on demand. Is the child latching on properly? Is the child feeding? How long does the child stay on the breast before you remove it or before he gets filled up? So we need to be sure of this. And I think you should recheck that weight, like monitor that weight. And if there is a downward trend, please see your doctor. Your child should be gaining weight and not losing.
Right.
Sorry, for the rotavirus, it should be given before 15 weeks. So your child at 16 weeks, the first dose she has missed it. So like Dr. Vera said, just try to keep your up your game on hygiene and try to prevent diarrhea in the child. Yeah, but it should be given before 15 weeks.
Okay. All right, so Dr. Tochi, another question is here about malaria and having blisters on the mouth. What is the connection? Someone says a child has malaria while they are treating, blisters started coming out of the mouth. What should be done?
Okay, well, there is nothing really you can do. So that is not really specific to malaria. It's called cold sores. It happens sometimes after a febrile illness, like any febrile illness, not necessarily malaria. When it happens, there's nothing. It's sometimes it could even be viral, so it takes care of itself. Just treat the underlying cause. In this case, the malaria, if it's confirmed it's malaria, and then there's nothing you can really do about the cold sore, about the blister in the mouth. It resolves on its own.
Okay. All right. Thank you, Dr. Tochis. ATPNs, those of you watching that are not members of ATP, please ask your questions. Dr. Tochi is here live to respond to all of your questions. All right. Don't miss this opportunity to ask about malaria and ask about any other issues you've always wanted to ask a doctor. Okay. While we're waiting on that, Dr. Tochi, a question came up in my head.
Okay.
But I don't know how. Okay, yes. There's this thing about children less than 6 months not being prone to contracting malaria. Is that true?
Less than 6 months. Okay, so there is this not is it less than okay. There is this HBF. I think it is much less than 6 months because I'm trying to put it in a layman's term.
I know.
HB, like hemoglobin of the fetal hemoglobin, like the hemoglobin in the fetus, which is the baby in the tummy. Sometimes it's has a protective let's say factor, like it protects against malaria, Okay. And then as that HBF gradually, HBF is fetal hemoglobin, that's hemoglobin of the fetus. So when the child is born, and then as it starts waning off, as the child starts acquiring like adult hemoglobin, kind of, it starts waning off, and then that protection is no more there. But it happens before 6 months. So children, it offers a form of protection, or is believed to offer a form of protection earlier, but it's not let's say general, like, we also see kids of 4 months, 5 months coming down with malaria and all that. So, but it's because of that, it's believed that HBF offers some form of protection.
Right. Okay. All right. So this is a question, Dr. Tochi. Well done. Thank you, doctor. Can the genotype be associated to malaria in children till they
Can
outgrow it.
can what?
The AA genotype. I think back in the day, people used to say if you are AA, you don't fall sick. There's this, I don't know
Or is it
how.
AS? It's AS now.
Okay, AS. So this
Yeah.
person is asking, can the AA genotype be associated with malaria in children? Most time when children fall sick, often they fall sick often and malaria is diagnosed. The next question is your child AA? When you say yes, they will tell you it is normal and the child will soon outgrow it.
Okay, maybe the person is just trying to, I don't know, put it in one form, but I think same thing with the HBF is also HBAS also has some protective, is believed to also have some protective factor, but there is no outgrowing of genotype. I don't know what she means by until she outgrows the AA or what. There is no outgrowing of genotype.
Yeah, right.
So, but
But
that thing,
maybe
like I
maybe
also,
she wants to know if I think you've answered it anyway. Like you said, whether AA, whether AS. If you were saying when I was reading the question, you said something about how that you even think it is the AA person that has that. I mean, you say it was the AA person that is likely to have more
more,
malaria.
yeah.
Right. So maybe it's just the question that I hope you have an answer for that right now. Okay,
So
so we
like,
have
oh no, sorry, I just wanted to add, like, all of these are not really well, I say cast on stone.
okay.
Just do this. What we've been discussing covers everyone, every age group, every
Genotype or
genotype.
blood
So
group.
just,
Yeah.
yeah, so just do all this to don't feel that you are AA or you are AS and you have protection and then you leave yourself and all that. Yeah.
Yeah. Okay. Someone was asking if there is a vaccine against malaria, just like we have the vaccine against COVID-19 and co.
Okay, so there have been a lot of studies, recent breakthroughs in providing a vaccine for malaria. Some of them are still being tested. There is actually a vaccine now that is still being tested, but I'm not sure
Oh,
it's
right.
available. Yes, I'm not sure it's available yet in Nigeria. So I believe that when it would have passed all through the stages and then testing is complete, that it will be made available. But at the moment, there is a vaccine, but it's still being tested, but not yet available in Nigeria. To the best of my knowledge, it's not yet in Nigeria.
All right. Thank you, Dr. Tochi. Lawal said that is asking, what are the types of ACT drugs that can be used for malaria for babies around 7 months? She wants to
Okay, Lawa.
self-medicate. I hope not.
The question sounds so right. So like we said, you've already called it ACT. ACT is ACT. As long as the drug is artemisinin combined therapies, that's the current recommended treatment. Like, we're not going to be calling brand names if that's what you're asking. ACT is ACT. And then, just by way of emphasis, kindly note that not every mosquito bite is malaria, not every fever is malaria. It's best that your child is tested by a doctor, malaria is confirmed before you institute treatment.
Thank you so much, Dr. Tochi. Lawal, I'm sure you got the answer right and spot on. And Jory Oluwole is asking, hi, doctor. My baby is 3 years old and 6 months. There is this heat rashes that appears at the upper back around the neck area that comes and goes. We have treated it variously, but it keeps coming and going. We also observed that whenever she's on antibiotics, the skin clears and becomes very smooth. Please, what is the cause of the reoccurrence? Thank you.
Okay, so like I said earlier, rashes are better seen. Like when you see it, you understand exactly what you're dealing with. But from the little history you've given, it may be an allergy, a form of allergy. I've not seen the rash, but I'm just saying based possible things it might be based on this the history you've given. It might be some form of allergy, so you may need to check what, especially because of the reoccurrence nature. If there are specific things that you have noticed that triggers it, or maybe you need to pay more attention to see if you notice maybe specific things that trigger it, that makes it come and go. It may also be from the way the child is dressed. if the child is too hot, it can cause the heat rashes, especially if the child is plumpy or on the big side, it can also cause that. So like I said earlier about rashes, it's better seen. I think you should let a doctor see this rash, especially when it's on, so that appropriate treatment will be given.
Right. Thank you so much, Dr. Tochi, for your very amazing and wonderful answers. Oluwatoyin, please, doctor, I want to know more about exclusive breastfeeding. Can the baby be given water at any time, or it just has to be breastfeeding alone?
Okay, so Oluwatoyin, exclusive breastfeeding means breastfeeding, like giving a child breast milk only from birth until 6 months. So when you add water or any other or milk, it's no longer exclusive breastfeeding. Even if you add water, it's, I think, predominant breastfeeding. If you add milk, it's supplementary breastfeeding. So it's not breastfeeding, breast milk only. That's exclusive breastfeeding.
Yeah. All right. Thank you, Oluwatoyin. You got that. Don't
So
give
sorry, I just
water
wanted
to
to
the.
add that breast milk contains all the water, like the water requirement your child needs is in the breast milk. So don't feel, won't this child be thirsty? How can someone eat? I know then that's what mothers say. How can someone eat food and
Yes.
the person will not take water? What type of thing is that? So your child, that water is contained in the breast milk already. God has already packaged the thing, so you don't have any problem. You don't
All
need
right.
extra
Thank
water.
you. Thank you so much, Dr. Tochi. So Augustina is asking, good evening, doctor. Please, what could make a baby of 4 months plus to okay, I think the child stood and it
Stools,
was
okay.
bloody. Yes, the baby is on EBF.
Okay, so now we don't know whether this is like blood stains stool or or bloody stool. I don't know if you understand what I mean. So
Yes,
I think
yes.
you should let your child see a doctor, please. Especially if this child has been having diarrhea. If the child having diarrhea, you notice blood in the stool, or most of the stool was bloody or what, let your child see a doctor. It might be an infection or so, but the child is 5 months. You should see a doctor.
Right. Thank you, Dr. Tochi. Thank you. Augustina, you just got that. Please ensure that you see a doctor as soon as, in fact, immediately. Thank you
Yes,
so much
please.
for that. Amalachuku is saying, please, what is the cause of high BP during pregnancy and how can it be cured?
Okay, so in pregnancy, we know that there are a lot of changes, in a mother's body, a lot of hormonal changes, a lot of changes. So there's something we call pregnancy-induced hypertension. So pregnancy can induce hypertension in some women, that is just associated with the pregnancy, and in some cases may resolve after the child is born. In some other cases, the woman may later develop hypertension even after birth, after giving birth. And then we have something we call preeclampsia. If the hypertension is after 20 weeks and associated with protein in urine and sometimes leg swelling, so we call that preeclampsia. And then eclampsia is now when someone has preeclampsia and then is fitting. These are some of the hypertension related issues in pregnancy. For the cure, it's like hypertension in the general population, that is managed kind of. The mother is, depending on the level, it's giving I'll say malaria, antihypertensive medications, and then followed closely all through the pregnancy, because we do not want complications. There are a lot of complications that could arise from pregnancy-induced hypertension or preeclampsia. So we advise you to please follow closely with your doctor. You will most likely be prescribed safe antihypertensive medications while pregnant, which you should take religiously and be closely monitored by your doctor. Thank you.
Right. Okay, thank you so much, Dr. Tochi. That was clearly responded to. Olanik Bekun is saying, good evening, doctor. Can someone else cause malaria? can something else cause malaria apart from mosquito bite? I'm sure she's just joining this call.
Okay, so Alani Pekun, like we said before, the transmission requires the vector, which is the mosquito bite, which is the mosquito, sorry. So you require the bite of a mosquito. Like we said before, there is no person-to-person transmission. Okay, so it's possible, will I say technically or theoretically, it's possible for you to get malaria from, like, you have a blood of someone infected and then you put it in the blood in another person's blood, like during blood transfusion. But cases of that is almost zero now because blood are properly screened before transfused. So if that's what you mean, it's almost zero, like getting transmission via that method is almost zero. So but it's mosquito bite, you can't get it by any other way.
Right. Thank you. Okay. Oluwatoyin is saying thank you, doctor. God bless you. God bless you, doctor.
You too.
Thank you. Amalachuku is saying, what can make a 2-month-old baby to breathe well during the day, but at night she breathes as if she has catheter blocking her nose and chest?
Okay, so several factors, especially if this child is otherwise well and then is on the plumpy side, when you lie flat and all that, especially if maybe there's no pillow under the child's head, you may have a little discomfort. So you may just try to make sure the child is laying down properly and is comfortable. And if this child is otherwise well, I don't think there is any cause for worry. As the child develops, respiratory muscles get stronger, the airways get stronger and all that, it will resolve. But if this child, if you're still worried after all this, or if you feel there is something else like cough and all that, you can take the child to see a doctor. But from what you just read now, there is really nothing to worry about. As the child develops and airway muscles get stronger and all that, the child will outgrow it.
Okay, so we'll just take 3 more questions and we will be done for today. Ruth is asking, good evening, doctor. I have some white stuff inside my baby's ear. Don't know if it's a wound or an infection.
Ruth, I think you should take your child to see the doctor. Don't try to probe that ear, so that you don't push whatever it is inside. You say you don't know whether it's wound or infection or even something you put in the ear. We don't know how old your child is, so just take your child to see a doctor as soon as you can, as soon as possible, so that the child will be properly examined and the white stuff will be examined and probably removed or taken care of.
Right. Okay, so we have another question from Augustina. Why am I having issues showing this? Okay, so Augustina's question, I went to see, okay, I think this is the same person. She asked the question before. Augustina, I need to know if you're asking a fresh question. Let me just quickly go. Okay, so Augustina is the one who asked about the 5-month-plus old child who stools blood or something. So I went to see
blood. Okay.
Yes, I went to see the doctor today, and we did a full blood count. No infection. Okay. Just the blood is low, and a bit of iron supplement was given.
Okay.
Different question. Anyway, it doesn't look like a follow-up one.
Okay. So if it's the same person and then you've gone to the hospital, well, just follow the treatment your doctor has given. Right, just follow the treatment your doctor has given and follow up with the doctor. The low blood should be followed up. I don't know what the HB level is, but just follow up on that. Feed your child properly and follow up on that.
All right, thank you, Dr. Tochi. And we have from Ekene Angela. Hi, doc. My baby was diagnosed with malaria and infection, sepsis, which made her to have fever and frequent stooling after each meal. Drugs and injections were administered to her. Now it's up to 2 weeks, the stooling has started again. What can be the cause?
Okay, so I want to believe that the stooling probably stopped and started again 2 weeks after. So, like we keep saying, help us with the age of your child. And then if this stooling, is the stooling watery? Is it frequent? Is it watery? We don't know if your child is still using diaper. Does it seep into your child's diaper? Is it watery? And then if it is, then you may also need to look around the child, like the child's environment, hygiene, washing hands after each diaper change, cooking and all that. If the child is in daycare, you also need to check that too and know if other people in his daycare or her daycare are stooling and all that. So hygiene, improper hygiene or poor hygiene can be a factor why if we've established that it's diarrhea, that is watery stool, poor hygiene can be a factor. You also need to take the child to follow up because 2 weeks is still too soon since he was recently treated in the hospital. So you may also need to take the child for follow up.
Okay, so I think this will be the last question for today's show. The way we are Ask the Pediatrician, this is Ask the Pediatricians Live, and we are here because Dr. Gumsala Brede, our founder, founded this organization about 6 years ago, soon be 6. Wow.
Yeah.
And so we've been doing this for years. So if you are not on our Facebook community, please go on Facebook, search for Ask the Pediatricians, and then send a joining request. You could ask your questions about your child's health any time of the day. We are always available. Although we do not attend to emergency questions, so if you have an emergency, please do well to go to the hospital. But if you want us to educate you, ask your questions on the Facebook group, and in about 48 hours, be assured that you would get a response to your question. Okay. Also, we have a sister group, Ask the Physicians, and that's where Dr. Tochi predominantly works. And what we do there is we answer questions for health questions for daddies, mommies, grandpa, grandma, every other member of the family. Because on ATP, as the pediatricians, what we do is just basically child health questions. So we have these two groups. Go on Facebook, join us, subscribe to our YouTube channel, ATP TV. We have loads of resources that you do not want to miss. All right, so we're rounding off now. I'm sure we've had a wonderful 1 hour. Dr. Tochi, it's been amazing having you on this show. Thank you so much for giving to the world. We appreciate it. So I'll just ask you the last question and we'll run along. Princess is saying, good evening, Doc. My 8-month baby has not cut a tooth yet. His poo is mucus and sometimes there's mucus in the stool and the baby hasn't got a tooth yet. Maybe it's 8 months old.
Okay, so just so that there's no relationship, like these are two questions. I know you put them together because you may think, is it this cheating? Yeah, so they are just two different occurrences, kind of. So for your child not cutting a tooth at 8 months, there's no cause for worry. Just give the child time and just keep watching the time. Give the child time that at 8 months, without a tooth, there is no cause for worry. Then for the stooling, you just need to watch it, and if the mucus persists, please see your doctor. It may also be a sign of infection.
Okay, so thank you, Awosaya. God bless you.
Thank you. God bless you.
God bless you, Dr. Bemi and the entire team. Thank you so much, Awosaya. We appreciate it. So, and this is us. We're rounding up now. Thank you for joining us. If you have further questions, you can put them up on our Facebook groups, and we will attend to them. Thank you. Do have a lovely day. If you want to watch a replay of this, you can check our Facebook group, or you could go on our YouTube TV. You will see the recap of a replay rather of this edition. Dr. Tochi, thank you.
Thank you too, Dr. Vera. Bye.
Bye, everyone. Thank you for joining us. Bye.
Bye.